please make a discussion on the proper use of mobility-related terms in hospice care. We'll explore key concepts and provide examples of patients to illustrate each term. Ambulatory refers to a patient who can move or walk independently or with minimal assistance. For example, patient 1 has terminal cancer but can walk short distances using a walker without help from others. Non-ambulatory describes a patient unable to walk independently. Patient 2 with advanced ALS requires a wheelchair for all mobility and depends on caregivers for transfers and positioning. Maximum assist in ambulation refers to patients needing substantial help to move. Patient 3 with late-stage Parkinson's requires 2 caregivers for stability and support when standing or walking short distances. A bedbound patient is unable to leave their bed due to severe illness. Patient 4 with advanced heart failure is confined to bed and needs assistance with all basic care needs. Transfer bed chair refers to moving a patient between surfaces. Patient 5 with late-stage COPD requires 2 caregivers to transfer from bed to wheelchair and may need support to adjust position due to breathlessness. Exercise prescribed refers to specific movements to maintain mobility. Patient 6 with severe arthritis does gentle stretching exercises to maintain joint mobility and reduce stiffness, often with caregiver assistance. Up as tolerated means a patient is encouraged to be upright as much as they can handle. Patient 7 with end-stage cancer sits up or transfers to a chair for short periods, monitored for signs of fatigue or discomfort. To summarize, we've covered ambulatory, non-ambulatory, maximum assist, bedbound, transfer bed chair, exercise prescribed, and up as tolerated. These terms help us tailor care to individual needs, ensuring safety and dignity throughout the end-of-life journey. What is the difference between ambulatory with maximum assistance and non-ambulatory with maximum assistance? Ambulatory with maximum assistance. An ambulatory patient with maximum assistance can move or walk, but requires substantial help to do so. Key feature: the patient is capable of walking or moving, but struggles and needs help due to weakness, instability, or other limitations. Non-ambulatory with maximum assistance. A non-ambulatory patient is unable to walk or move independently at all. They are completely dependent on others for any form of mobility. Key feature: the patient cannot walk or move on their own, and all mobility tasks require help, including transfers or adjustments in position. Summary of key differences. Ambulatory with maximum assistance. The patient can move but requires significant help. Non-ambulatory with maximum assistance. The patient is completely unable to move independently and relies on caregivers for every aspect of mobility. In hospice care, the Karnofsky Performance Status and Palliative Performance Scale are used to assess functional status and prognosis. A score of 50 on both scales indicates significant functional impairment. A KPS of 50 indicates the patient is severely disabled but still able to perform basic functions. They require assistance for most activities. The patient may not be able to walk independently and may require maximum assistance for any movement, such as transferring from bed to chair. A PPS of 50 means the patient has a severe reduction in function. They are confined to a bed or chair most of the time and may have some ability to sit up with help. The patient will likely need caregivers to assist with repositioning, moving to a chair, or transferring from bed to another surface. Combining KPS 50 and PPS 50, the patient will have severely impaired mobility and ambulation. They are likely to be non-ambulatory, dependent on maximum assistance for all transfers, and may spend most of the time in bed. For example, a 75-year-old hospice patient with end-stage cancer experiencing severe fatigue, weakness, and pain would have a KPS of 50 and a PPS of 50. They require 2 caregivers to help with all transfers and are mostly bedbound. In summary, for a hospice patient with a KPS of 50 and a PPS of 50, the expected mobility and ambulation will be very limited. They will likely be non-ambulatory and require maximum assistance for any movement.